Welcome to the presentation on bloodborne pathogens, limiting your risk of exposure. The information for this presentation has been compiled from the Occupational Safety and Health Administration, or OSHA. It, however, does not replace a complete course. Also want to point out that schools or school districts may have additional policies and procedures that would fit their specific needs, and every work site needs to have an exposure control plan. You want to make sure that you can access this plan and you understand your role in your district's exposure control plan. All work sites are required to identify people whose role may make them more likely to be around bloodborne pathogens. These people in a school setting may be a nurse, a custodian, a coach, a special education teacher. It truly depends on your role. That being said, everyone in the educational setting has to understand the dangers of infection and the procedures that you can do to minimize risk. The bloodborne diseases that pose the greatest risk that we're going to talk about today are hepatitis B virus, hepatitis C virus, and human immunodeficiency virus. HBV is actually a liver disease. It poses a greater risk than HCV and HIV because it is more easily transmitted. HBV can survive up to a week in dried blood. The good news about HBV is that it can be prevented by taking the HBV vaccine. If your role has been identified by your employer that you would be at an increased risk, then this will be covered by your employer. Hepatitis C virus is the most common chronic bloodborne infection in the United States. People can be infected with HCV but not be aware of it because symptoms can sometimes take quite a while to be recognized. HIV is the virus that leads to AIDS. A person can carry HIV for many years and not have any symptoms until it turns into full-blown AIDS. AIDS attacks a person's immune system and it makes it difficult for the body to fight off diseases. Ways that bloodborne pathogens can be transmitted at work can happen in a variety of ways. Blood can come into contact with an open sore, so you want to make sure if you do have an abrasion or a cut of any type, you have that covered before you come to work. It can be through a puncture in the skin of some sharp object or even a bite. Contaminated blood can enter your mucous membranes through a splash that could go into your eyes or your nose or your mouth, and it can be picked up from contaminated surfaces. Things that you can do to reduce your risk of exposure would be to first and foremost use universal precautions. That just means that you consider every person, all blood, all bodily fluids as potential carriers of infectious disease. You want to always use personal protective equipment. You also want to make sure that you use proper disposal of that personal protective equipment. And hand washing. Gloves are going to be your best friend. They're your first line of defense and a great barrier. Anyone and everyone needs to know where gloves can be found, and you want to make sure that those gloves fit appropriately, that there's no holes in them, no tears. Gloves work for everyone. Then from there, just depending on your role, you may need an apron or a coat of some sort to protect additional skin or your clothing. You might need protective goggles to wear if there's a lot of splashing. And definitely if your role requires you to perform CPR, you want to make sure you have a mask that has a one-way valve for your protection. All personal protective equipment needs to be provided by the employer at no cost to you. You want to make sure, again, that it fits appropriately and there's no imperfections in any of it. You want to make sure you know where it is and you can get to it when you need it. Since everyone should have access to gloves, we're going to talk about glove removal. It's important that if there are any contaminants on those gloves, they stay on the gloves. A good rule of thumb to remember when you're taking off gloves is that skin should touch skin and gloves should touch gloves. That's it. So your first step, you're going to take your glove, With both hands still gloved, you're going to grab the outside of one of your gloves at the very top of your wrist. You're going to peel that off, that first glove off, away from your body, away from your wrist down towards your fingertips, and you're going to turn that glove inside out as you go. Then you're going to hold the glove that you just removed in your still gloved hand. And with your ungloved hand, you're going to peel off the second glove by inserting your fingers inside the glove at the very top of your wrist. You're going to turn that second glove inside out while again tilting it away from your body. You want to leave that first glove inside of the second, like a little bag, and you're going to dispose of those gloves whatever way your exposure control plan tells you to. We would never reuse gloves, even if you feel like there's nothing on them. We always throw those away. Your final step is then to wash your hands as soon as you can. Washing hands is very, very important. You want to make sure that you wash your hands after coming in contact with any bodily fluids, even if you had on gloves. We still need to wash hands. You need to wash them for a minimum of 20 seconds, and you want to rub vigorously on all the surfaces of your hands, including your wrists and your fingernails. You want to rinse your hands thoroughly, dry them with a clean paper towel, and discard that paper towel. Then you're going to need to get a new paper towel, turn off the faucet, and discard that paper towel as well. Additional precautions that you can take would be to clean up all blood or bodily fluid spills promptly. And you definitely want to refer to your exposure control plan for this. If you don't know how to do it properly, you need to get your custodian to help you. There's a variety of tools that they'll have and special procedures that they need to follow, depending if it's blood or if it's vomit, and you need to use those correct procedures. You don't want to eat or drink, apply lip balm, contact lenses, any cosmetics when you're exposed to blood or bodily fluids. You want to wait till you're out of that environment. You want to make sure that we're disposing of sharps and other potentially infected materials in the appropriately marked containers. So whether that's a red biohazard bag or a hard sharps container, you want to make sure everything goes in the proper disposal. We never want to push down on trash with our hands and feet because you can never be certain if there is some sort of sharp object in there, so you just want to use that as an additional precaution. When someone is bleeding, first and foremost, we want to send for additional help. We want to get more help to come. You want to use the protective gloves and assist that person as you've been trained. If at all possible, you want to ask the person who's bleeding to apply pressure to their own injury. Your next step would be to report this incident to your principal, school nurse, and follow the protocol in your exposure control plan. If for some reason you have been exposed to bloodborne pathogens, you immediately want to wash that exposed area with soap and water. You want to get rid of that contaminant. If you're not able for some reason to wash with soap and water, you want to flush the area with clean running water. Maybe if it's gone into your nose or your mouth, you want to flush that with clean running water. If it's gotten into your eyes, you want to irrigate the eyes, same thing, with clean water. Continue to flush that with water or saline to get rid of that contaminant. Once it's been removed, you want to report this incident according to your district's exposure control plan. If you need advanced medical care, that's going to be your next step. And then whatever is in your exposure plan. You don't want to stop any of this process to do paperwork. First and foremost is your safety. You want to get rid of the contaminant, find out if you need advanced help, and then start your reporting. By following OSHA precautions and your district's exposure control plan, you can reduce the risk of bloodborne pathogens.